everybody. I'm Susan Collini, and welcome to our Renaissance Center Roundtable. And today, I'm sure all of you are trying to bury out of whatever snow you've had. We were just talking about our snow situation yesterday. So here in Pennsylvania, any of us have had anywhere from 18 to 24 inches of snow. So if you're watching us from New York, I know our New York friends have gotten about 24. So anybody heard more than that? Somebody said in the Poconos they had 30 inches.
Yeah.
Our weatherman.
Yeah, it's Poconos.
That's it. Ronnie keeps us
We get
informed.
some reports out of that area.
That's right.
So, yeah,
That's right.
very
So let me introduce everyone again in case this is the first time that you're watching us. To my right, your left, we have Ronnie.
Hello,
Ronnie works in our medical office and one of our medical associates. We have Derek, who's the head of our laser
Hello.
clinic. We'll give you all kinds of information on laser. And over there in the front, we have Ashley, who's one of our estheticians, and Marley, who is one of our physician assistants. Of course, Dr. Collini is in the operating room today, so he's not with us. But we have a very special guest today, Carrie from Miradry. So we're going to welcome Carrie from Miradry. We're going to let her speak in just a minute. so
We put everyone on the spot.
we're impromptu. So. This is a really interesting laser segment that we have today because Miradry is very, very interesting. I'm actually going to, because you know I can talk forever, so I'm going to actually throw this out to Carrie and just tell us what Miradry is, as though you're trying to sell me that machine.
Sure, of course. So it's an honor to be here with you guys. Love all of you. It's so much fun being here. So to give you guys a little bit of an overview with Miradry, it is a laser device that does deliver thermal heat energy in the underarm area. So what we're doing with this is we are actually permanently reducing sweat, odor, as well as a hair reduction in the axilla area. So this treatment is amazing for somebody who suffers from hyperhidrosis, excessive sweating, or somebody who's just bothered by their sweat and odor, doesn't want to wear chemical deodorants anymore. And the best thing about this treatment is that it's permanent.
We love that. I mean, I can tell you that I think we purchased the equipment about a year and a half ago, I think. So we've been doing this treatment a year and a half here, so we've had experience with staff members and customers. Our customers are really, really thrilled with it. And one of the things that we do to mention what Carrie said is so many times lasers are ongoing treatments. And when we say permanent, the one thing that we like to clarify is that most patients require one treatment. Occasionally, patients require a second treatment, and if they do, we literally do it at cost for them. So that you know, we're going to give you the price up front at the end of the segment, so that you know we're giving you specials for the rest of the month, because we just think this is so cool and everybody should do this. So I think at that point I'm going to take it to Derek, because Derek has got a tremendous amount of experience with it and really can explain
Yeah, so some
what
of
you
the
might want to
things,
hear.
As somebody who suffers with hyperhidrosis, I know that it's really something that bothers a lot of people, and I'm always talking about the fact that men do this as well, because I have a lot of people come into the practice and they'll say, is this just for women? No, it's for men. Those are typically the people I see getting another treatment if they have a very large area or they're very heavy sweaters. Otherwise, I've had tremendous success with just one treatment. It's up to like an 85% reduction in sweat and odor. And the one thing that's really great about it is you have people, and they're on the fence about getting into surgical intervention or going a little bit of a step above as far as downtime. So this is something that can be done, it's done in office. We numb you, you're very comfortable, you're just laying there. We basically map out the procedure. If you want to look up in our history, I think we have some videos of us doing an actual Miradry procedure. And then you just have a few days of a little bit of swelling, discomfort. You kind of feel like you have tennis balls underneath your arm.
You're a little swollen.
You immediately start to see that major reduction in sweat of the underarms and odor, and then down the line you start to see that hair come out and you start to see a nice smooth, dry underarm. So it's great.
I know for myself, I used to really perspire a lot, to the point where if I was coming out of the shower very fresh and clean, I put on a shirt, and before you know it, I was perspiring, and so it was really altering my choice of clothing, so my lifestyle was changing.
No colors.
Because I was wearing black I mean, I love black anyway, I'm so used to wearing black, but colors were starting to go to the back of my closet rather than to the forefront of my closet. So I know that that's one thing I've heard as I've talked to patients, and I think that this is such a great solution to the problem. There are other alternatives, so we're going to hit that with Marley. Marley's our physician assistant, so she's going to talk to us about, I know Botox and surgery are alternatives, so I'll let you tell our audience about that and maybe why they might want to do that or not want to do that.
So yeah, Botox is an alternative, but unlike Miradry, it's not permanent. So you have to keep coming for Botox injections every about 6 months, sometimes even sooner. And then the other alternative would be surgical excision of the sweat and odor glands, but that you would have, you know, a pretty significant chunk of downtime, whereas this, like Derek was saying, you know.
Takes care of it.
Yeah.
Plus, believe it or not, the surgery is about 3 to 4 times as expensive, so I can tell you that. The surgery is great, but it is more expensive than the laser alternative.
Yeah, and it is surgery, so you would, you know, have to be sedated or intubated, you know, under general anesthesia, whereas this, just in office procedure, either myself or Dr. Klingy will just put some local numbing medication in the area Derek's gonna treat, and then it's good to go.
There you
go.
Yeah, it's quick and easy, yeah.
That's right.
Yeah,
Now,
really safe.
I think that was a great explanation. So those are the 3 alternatives. Botox, I know, is in the media all the time about being a treatment, but it is quite expensive
Very
in the long
And
term, and
there's
it's
no
lots of needles.
permanence to it.
Yeah.
Lots of needles, lots of discomfort. I mean, it was
Yeah.
something
A lot
that
of
really
product.
alleviated that for people. And another thing with Botox, and it is a safe treatment to do, we all get it done. But if you are trying to live, I know myself, you try to live a more natural lifestyle, and one of the things that is very toxic are the antiperspirants and high aluminum content deodorants. I used to burn myself with certain dry so that I didn't have to deal with it, and not realizing that's very bad for your system. So this is something that goes in, and it's not a chemical reaction. This is something that we go in with energies, and then it's done, and you don't have to keep treating with those chemicals and possibly exposing yourself to something else.
Another thing from the medical standpoint is some people are, well, don't I have to sweat? Isn't it bad for me to not sweat? No, you only have about 2% of your sweat glands in your axillary areas, so we do need to sweat, but it's okay to not sweat from that area.
Okay,
There's
now,
sweat
now
glands
what did I
everywhere
used to
else.
say? What was my expression? Because I had many people that would say that to me. I would just say, hey, listen, I'll sweat anywhere else, I'll just wear a skirt and catch the breeze. That's what I used to say all the time. It was better than, having axilla, stains in clothing.
And I have a lot of people ask me that question.
Yeah.
Isn't this bad for me? Aren't I
No.
losing some kind of toxic release? Which
No.
is also not happening. That's
Yes.
that
So-
doesn't
So
happen.
your whole skin is your organ system.
Takes care
Right.
of
So
everything.
your skin will deplete whatever heat that your body needs to excise and.
Yeah,
you're
we're sweating from every inch of our skin.
Yeah.
You just don't notice it because, some areas sweat more than others, but your body will definitely from
Unless you
other
have
places.
hyperhidrosis.
Yeah.
Then you're really gonna
Then you're
notice.
gonna, yeah.
That's
But
it.
yes, yeah.
So now at this point, we haven't heard from Ashley, but I've been saving Ashley towards the end only because she's had it done. So I want her to explain her experience and what she's felt from the procedure and how much clearance that she's had.
So I wasn't like an overactive perspirer per se, but I was one of those people who didn't like wearing deodorant because of the bad chemicals and the cancer causing aluminum. So I wanted to get it done just so I didn't have to deal with wearing deodorant anymore. And the treatment itself was very comfortable. I got numb. That was probably the most intense part, if it even was intense. It's just a quick little poke, very comfortable, very tolerable. And my armpits are very small, so it took me maybe about 45 minutes.
Yeah, it was a very short
It was really
procedure.
quick. If your surface area is a little bigger, obviously it's gonna take a little bit longer, but I mean,
No extra cost.
no extra cost
extra
at all,
cost for
which
that
is
larger
great. And also, so then when I went home, I was very swollen. I was numb for a couple days just because of the numbing and then the procedure. It's common to have bruising and a little hicking because the device does use a suction technology to suck up your armpit and all the glands in the hair follicles. And that's another bonus too, is it reduces your hair. Now my hair did grow back a little bit, but it's not as intense as it was. Like it's a little more less, like it's more sparse, a little more patchy, it's fine, and it actually takes a little bit, like my hair would come back like in a day. It comes back maybe every 2 to 3 days, so the growth is a lot slower, which is nice, but I don't sweat anymore, I don't smell, it's kind of gross, but there's no body odor in that area, and I haven't used deodorant in 2 years, this was 2 years ago I had it done.
Think of the savings in deodorant.
Savings.
And in 2 years, it has staying power because people ask
Exactly.
of efficacy and how long that's going to last. There's permanence to
Permanent.
that.
So whatever we get in that first treatment, it does not come back. Whatever sweat glands are destroyed, they do not go back. But as Susan said, about 20% of patients, especially if you're heavy hyperhidrosis, you will most likely need that second treatment. Just to kind of seal the deal and get whatever is left, but with up to 2 treatments, you will see up to about an 82% reduction, which is awesome.
No, I have a question for Miradry.
Okay.
Are they planning on branching out to any other areas, please?
It's something
Please.
that we have been working on.
Palmar hydrosis.
Something that we have been working on, but I can't reveal any
Okay.
information.
But it's
Sorry,
being
guys.
worked on.
It's
Alright.
something that we have
Always
been working
that
on.
tease.
Technology is always in the works, and that's always a good thing, but I know that there are other areas, and Derek and I have spoken about his hyperhidrosis, but, you know, sweaty palms, sweaty feet, those kinds of
Yeah,
things, but,
sure.
you know,
All that stuff.
there are other issues that, I know that they've been telling me, because I know they wanna keep us in the loop with any new, with any new
Any new
equipment
stuff.
that we could possibly have, but, I think I'm gonna ask Sarah. Sarah's behind the camera back there, and she's watching. Are there any questions for us live? Because
There are
sometimes
not.
we get some questions.
And don't
And
hesitate to ask.
just to remind people, if they have any questions, throw it out there now before
Yep.
we come to any kind of a close. No
Nothing
questions?
yet.
So I know that the biggest thing is now people are probably thinking about price. So I will let you know, our normal customary price is $19.50 for this treatment, for the first one treatment, and if we need a second treatment, it is $800, because that's literally our cost for our procedure, and we want you to have it done, so we're not trying to soak you up for 2 treatments. But for the next month, and this is the best time of year to do it, while you're inside and you're not
Prepare for
thinking,
summer.
get
Summer.
prepared for summer.
Sweat season.
We are offering this service at $1,700, so it's really a really good
Great
price
value.
and value for the service. So, you know, anytime that you're interested, you can give us a call and make an appointment with Derek. And our number is an easy one. It's 570-674-5555. 555. Did I say enough? 5? Too many 4 5s. And you can reach out to us. And I want to just say, I didn't get Ronnie in there, so.
It's alright.
So, Ronnie's always in charge of equipment
Yeah,
too.
I'm making
He's
sure
the
our
one who
cameraman. Yeah.
maintain it, so I'm gonna go around the whole table again and let everybody have their last say if there's anything else that they wanna talk about before we sign off for the day, so quickie, but
I mean,
go ahead, Ronnie, I'm
yeah.
sorry I didn't bring you up.
That's
before.
okay. I mean, I like the Miradry procedure. Me and Marley, I assist her in getting people numbed up for this, and then make sure Derek's all good down there. It's a great procedure. Patients are very happy with it, and you lose that exhale of sweating, and people, you know, they suffer with that and have an emotional attachment to it. So it's good to see them a lot happier afterwards. So yeah,
Absolutely.
Thanks, Ronnie.
you're welcome.
Derek, what else would you like to chime in?
I love it. I do it on a lot of people. I see a lot of police officers. So if there's anyone out there they have to wear those gray shirts, it kills them in the summertime.
It's hot.
So yeah, it's good. Men, women, anybody who is suffering from that. And like Ashley said, it does do a reduction of the underarm hair, but it's not total removal. So you don't have to worry about that if you're a male looking to get it done. But yeah, it's a great procedure. I would recommend it to anybody.
Carrie?
So I think for me, just working with Miradry, I hear a lot of success stories from patients all across the country, and I think what warms my heart is really just to have people come up to me in tears and say how much this treatment has changed their lives.
Yeah.
You know, between, you know, not having that heavy sweat, for them in tears saying that they don't have to wear all black. I met one woman who was buying 2 shirts of everything, going to work and changing her shirt on her lunch break halfway through the day. So I think we really don't realize how much people are affected by hyperhidrosis and excessive sweating. So I think my reward is that this treatment really is life-changing. So
I
Agreed.
think that's great,
Yeah.
that's great. Ash?
So I think it's a very good treatment. I love it. It's really efficient, and then it's really nice to not have that sweating and then that odor, and then that problem with, like, if you're worried about any chemicals, because I know a lot of people like that more natural result with products, and it's a really good overall treatment. I'm so happy with it, and no more sweat.
And oh, sorry.
Oh, it's
Ash.
okay. I just want to have more things. So too, probably the most annoying part of it was just because you're swollen for a couple days, and it's like it feels like you can't put your arms down. I kind of felt like the kid from the Christmas Story. I can't put my arms down. But it was one of my favorite treatments that I've gotten done. So, yeah.
And Marley, I wanted to finish up with you for any medical information that you wanted to give at all, or just your experience with it.
Yeah, I think I touched on all the medical points I wanted to, but if you haven't been, just a plug for the Kalini Laser Clinic. Again, it is just so beautiful and so tranquil, and other than the part where I come in and numb you up, that's the only uncomfortable part of the procedure. The rest of it, you're just laying there with Derek in this beautiful, tranquil area.
It's peaceful. It's very spa-like.
Yes, so spa-like. I love when I get to go numb a patient because it can be a little hectic up here some days, so it's like an escape. So, yeah.
And I think you were surprised at the ease of the treatment in general and how fast it was.
Yes, definitely. Yeah, so, yeah, patients seem to be really happy with it, and other than the numbing part, the rest of it's just...
Piece of cake.
Yeah.
Okay.
Yeah.
So on that note, I just want to close up with a final mention of, you know, our COVID policies, because we're distanced away from each other, but we're all in our facility, we've been fortunate enough to be vaccinated. So we do have a lot of protocols. You can see all the things we do online to protect you and protect anyone that comes into our facility. We do have electronic locks on all our doors, so we're not trying to keep you out, we're just trying to keep everybody very safe. So on that note, I want to mention that our very next roundtable is March the 3rd. Our topics are always a surprise, so we keep that at bay because we try to have guests as lovely as Carrie come and visit us and give their input, and you know, we're always trying to make sure they're here, and sometimes their schedules are disrupted, so we like to keep it to the last minute to make sure that our schedule is solid, and so we will keep watching and keep listening for who we have in March. But we've got some good plans because this is the time to be treated before the summer comes, so we're very busy with our laser clinic, and we hope to see you soon.
Sweat-free summer.
Sweat-free summer.
Bye.